My name is Madison Gray and I'm a nursing student at the University of South Alabama, and I'll be performing hand hygiene and wet-to-dry dressing change. Before I enter the room, I'm going to verify the order, check hospital policy, and gather all of my materials. When I enter the room, I'm going to use an antiseptic hand rub, and I'm going to use two identifiers to identify my patient. I'm going to use the medical record and the patient's armband. I said his name is Jaguar Jones, and he was born on August 25th, 1963, and he has an allergy to penicillin. Now I'm going to explain the procedure to my patient while maintaining privacy by closing the curtain. Now I'm going to perform hand hygiene using soap and water. It's important to use soap and water when you come into contact with spore-forming microorganisms such as C. diff, your hands are visibly soiled, or after using the restroom. You can use an antiseptic hand rub before entering or leaving a patient's room or touching any objects in the room such as furniture. Before I begin, I'm going to remove any jewelry, push my sleeves and watch above my wrists, and then I'm going to inspect my nails, making sure that they're short, and my cuticles in my hands for any cuts, abrasions, or open lesions. Now I'm going to turn the water on gently so it doesn't splash, and I'm going to check that it's a warm temperature. And now I'm going to wet my hands and then apply 3 to 5 milliliters of antimicrobial soap, and I'm going to lather my hands for 20 seconds, making sure to get in between my fingers and on the top and bottoms of my hands in circular motions. And then I'm going to make sure that I clean my nails. And then it's also important to keep your hands below your elbows too. Now I'm going to rinse the soap off in the water. And then I will dry my hands with one paper towel, one at a time, from my fingertips up and dispose. And then I'll do the same thing to the other hand. And then I'll turn the water off with the paper towel. Now I'm ready to perform the wet to dry dressing procedure. First, I will move the trash can to where I need it, and then I'll perform hand hygiene using an antiseptic hand rub. Now I'm going to lift the patient's bed up to an appropriate working level and lower the handrail and make sure the patient is positioned comfortably. Now I'm going to put on my goggles and my clean gloves. Now I'm going to expose the wound and the suture line, making sure to still maintain privacy. First, I'm going to lift the tape up towards the wound. And then lift it away from the patient, the dirty side away from the patient. And I'm going to assess the drainage for the type, amount, color, consistency, and odor. And now I'm going to remove the inner packaging, assessing the wound size, the tissue type, granulation, necrosis, slough, and the odor. And now I'm going to palpate around the wound, noting the redness, edema, and any tenderness noted by the patient. Now I'm going to discard of the dressing into my glove, using glove to glove, skin to skin, and facing downwards towards the trash can. Now I'm going to set up my sterile field. I'm going to hold it on the 1-inch border and lay it out on a clean surface. Come off. And anything that is below my waist level is considered contaminated. It's appropriate to have it at your waist level. Mine's a little bit above. And you want to make sure of your 1-inch border when you are dumping out your contents onto your thing. Now I'm going to do my saline. I'm going to check for the expiration date, and I see it's not expired, and I'm going to palm the label and open the cap facing upwards, and I'm going to pour it carefully, making sure it doesn't splash, and also not touching my the edge of the container. Then I'm going to recap it and set aside. Now I'm going to don my sterile gloves. touching only the inner flaps and the 1-inch border. I'm going to put on my right hand first, and then touch on the inner flap. Now I'm going to organize my stuff, and I'm going to put gauze into the saline. Now I'm going to assess the suture line for the size, the approximation of the edges, drainage, and any other abnormalities. Now I'm going to clean the suture line. It is important to clean it from the least contaminated to the most. First, I will drain the excess fluid, and I'll clean the center first and dispose above my waist. And do it again down the right side. Dispose. And now the left. Now I'm going to pat it dry. And dispose. And now I'm going to pack the open wound. I'm going to squeeze out the excess fluid again and pack it loosely, making sure not to touch the edge of the wound. And while making sure to fluff the gauze. And now I'm going to cover it with one dry gauze. And now we'll do the ABD patch, only touching the blue line. Now I'm going to remove my sterile gloves, doing glove to glove and skin to skin. Now I'm going to tape the edge. Normally I would initial, date, and write the time on a tape and place it on the ABD patch. Now I'm going to position the patient back to a comfortable level and lower the bed to its lowest position and raise the side rails. Now I'm going to perform hand hygiene and dispose of all of my materials, and then I'm going to document all the points of the intact suture line and the open wound and how the patient tolerated the procedure. Thank you.